Hello friends, you are welcome back to my channel. My name is Ikaprete Egbalibo. I'm a medical laboratory scientist. Today's video is a continuation of the previous video I made on urine culture. Today I'm going to be explaining to us on how to read culture plates in urine bacteriology. However, it is important to note that there are several inoculation techniques, and the method we used in the previous video was the standard wire loop method. And also, it is important as well to also note that in bacteriology practice, all procedure has to be done aseptically. Before we go to the bench, there are two fundamental points for us to note. Which one of them is significant bacteriuria? Now, literatures have proven that in urine bacteriology, urine culture is said to be significant or considered to be significant when there are visible colonies that are up to 10 raised to power 5 colony forming unit by a ml of urine that is cultured. Now, in our previous video, we didn't use up to 1 ml of urine. We used the standard wire loop. Now, the standard wire loop we used in the previous video dispense a urine volume of 10 microliter. So, we are going to use that 10 microliter to extrapolate, to calculate our significant bacteriuria. Now, in order for us to do that, we can do the simple mathematics by saying, convert the 10 microliter to a ml. And if you try to do that, you have 0.01 ml of urine. Now, if we dispense 0.01 ml of urine, let's use that to cross multiply the 100,000 colonies. You arrive at 1,000. This implies that in every 10 microliter that is cultured, before you said the bacterial colony is significant, you must count visible colonies up to 1,000 colonies. Having said this, there are some exceptional cases, like we mentioned, that samples can be gotten as a suprapubic aspirate from the bladder. Now, in this case, we all know that the bladder is sterile. Now, if the bladder is sterile and the procedure was done aseptically, any colonies that we isolate from our culture will be regarded significant. Why? Because the urine sample that was gotten from the bladder, directly from the bladder, is sterile. So it has to be treated as every other sterile site. Another point to also note is this. There are people, most especially the pregnant women, those that are under chemotherapy, their immune system drastically fall below normal. So these people are regarded as can be regarded a group as the second group, which to be regarded given special preference. Which other literatures has also proven in most cases that those set of people, as low as 10 raised to power 3 colony forming units, should be regarded significant. The very last point for us to consider in reading plates in urine bacteriology is the mixed growth. Now, literatures are proving to us that, and also we have also experimented this on a daily routine, and it is an established fact. There is never a time where more than 2 isolates or 2 different organisms causes a co-infection, co-urinary tract infection. So, whenever more than 2 isolates, despite the fact that the colonies are significant, whenever more than 2 isolates is identified, more than 2 different organisms is identified in our culture plate, we term it as maize growth. And this is likely to be the fact that the patient didn't collect the sample in a proper manner. So, having put in all this into consideration, now let's go to the bench and do some plate reading. Let's go. You are welcome to the bench. So, let's proceed to see what we have for today. We have all the plates lined up already, the beer and the clear. We have mashed all of them. So we'll now start reading. Let me start from here. Here there is no growth at all on the beer and also on the clear. And let's take, I think there is a, this is unique. Zoom in and look at it. Zoom in and see. Now, from what I'm seeing here, the colonies are more than 2. I can see a very whitish one. I can see a grayish one. Both of them are small. Then I can see another very tiny one. Then the golden color appearance is also here. So there are about 4 colonies. So like I said, you can zoom in and come and zoom in and see. So like I said, in this case, this is a perfect mixed growth. So it is likely that the patient didn't produce this sample appropriately. So the patient will be advised to produce another sample. This is nice. The growth seems to be uniform. You can see on the clear, it's very clear. And you can agree with me that this is one single organism growing here. So with this, we can now proceed to do colonial morphology, where we describe what we are seeing. So on colonial morphology, we are going to look at the size, the color. You are going to also look at if it's elevated or if it is flat. On the clear, you are going to identify also or to check if it is lactose fermenter or non-lactose fermenter. You are also going to look at the moisture of the organism. Then the shape, very important. Those are how to describe your colonial morphology. Then after doing colonial morphology, you send for biochemical and sensitivity, which is antimicrobial susceptibility testing. Okay, which is on that bench. I believe on my second video, on my other video, I'm going to also do that using CLSI standard. We also have another one here. This is the BA. If you count the number of colonies here, it's far below the 100,000, 1,000 that we concluded to say that is significant bacteria. So this is insignificant. Insignificant. If you count, this will be like 1, 2, 3, 4. It's definitely far below 1,000. And this is another case too. This is on the flex. Its colonies are far below 1,000 colonies, so this is also insignificant. Then also this is also insignificant. This is also insignificant. Okay, that is how to read plate on urine bench. Watch out for my next video where I'll be talking about susceptibility testing.